My very great pleasure now to introduce Dr. Polly Livermore. Polly stayed up late in the UK to talk to us. Dr. Livermore is a senior paediatric rheumatology nurse at Great Ormond Street Hospital. She currently serves as the Great Ormond Street Hospital's Biomedical Research Centre Clinical Academic Program Lead. She completed an NIHR-funded clinical doctoral research fellowship at Great Ormond Street, focusing on the psychosocial needs of children and the young people with JDM. Subsequently, she became the first nurse in the UK to receive a very prestigious NIHR Advanced Clinical Research Academic Fellowship in 2023. Polly's wears many hats. She holds various leadership roles, including Chair of the Health Professionals at the Paediatric Rheumatology European Society, Associate Editor for Rheumatology Advances in Practice and Communications. She's also actively involved in the Centre for Adolescent Paediatric Rheumatology at University College London, and she's also involved in the Centre for Outcomes and Experience Research in Child Health and Illness. And Polly's going to talk to us today about the research that she's been doing at Great Ormond Street. Thank you, Polly.
Thank you so much, Andrew, and thank you so much for having me here. I feel really, really honoured to be invited to come and speak to you today. It is quite late in the UK. It's gone 9 o'clock now. My 3 adolescent boys are getting ready for bed. So hopefully I can do this justice. So I was invited to come and talk about juvenile myositis and how that impacts upon family stress, which is some of the work that I've been doing over the last couple of years. I have a couple of disclaimers just to highlight for you. So I am a qualitative researcher. So this research that I'm going to be presenting to you tonight is very different from the 2 talks that you've just heard previously and from the 2 talks that are going to be following on from me. And that's partly because I'm going to be including quite a few quotes from families. So hopefully that doesn't upset anyone too much upon the call. And if it does, obviously feel free to reach back to me afterwards. So as I go through my talk, I just want you to kind of bear in mind some of the things that I'm going to share with you on this slide now, and just think about as I go through my presentation tonight. So I'm going to share with you a patient journey. I'm on the train with my 13-year-old. We're on our way to the myositis clinic. They are grumpy and monosyllabic. I wonder if they are as anxious as I am. We sit in front of the physician. They want to start a new therapy. I want to know what side effects we will experience. I want to know whether there is a risk of malignancy. I want to know how to get them to take it when they don't want to. I want to know what answers I will need to know when we leave here. I want to know whether this will work this time. We leave the clinic. I haven't asked these things. I couldn't ask these things because it's not my disease. I don't want to put worries into my child, and I don't want to admit to my child that I need help. So the work that I'm going to be presenting to you today is that from a parent perspective, a parent of a child or young person with juvenile myositis. So just to give you a tiny bit of background, just a couple of slides on who I am. So I qualified in 1997 as a children's paediatric nurse, and I started a role on the rheumatology ward. I then went on and did that for a couple of years, and then I went into rheumatology research. I was the first tocilizumab study. I did that at Great Ormond Street, and the first infliximab study. Started going away to conferences, presentations, doing some kind of publications. I then became a rheumatology advanced nurse practitioner. I became a nurse prescriber. I ran the ambulatory daycare unit for a number of years, administering these therapies to children. And then foolishly, I went into management and I became a rheumatology paediatric sister and a rheumatology matron. But I think what's important that I wanted to share with you today is my interest in juvenile myositis and why that came to be. And as I qualified as a very, very junior, inexperienced paediatric nurse, There were two children on the ward at the time who came in very, very early on into my career, who were both 5 years of age, who both had juvenile myositis. One of those was male, one was female, and they had a very kind of different background and different journey in how they came to be. But I had a very important role to play in caring for them, and I became very interested in juvenile myositis and how we can improve that family experience. Unfortunately, both of these two young children both died from their rheumatology condition, but their journeys and their kind of pathway and how they fitted in their family really stayed with me. And so that's where my work has come from over the last number of years. And you can see here a number of papers that my work in juvenile myositis and dermatomyositis has come from. And that's because of this interest of how we can improve support of children and young people and their families with these conditions, living day to day with them out there. So my current work, I'm funded to do a postdoctoral fellowship, and it is to design, develop and test an intervention. This is about supporting families of children and young people with any rheumatological condition. We know from my previous work in my PhD that there is very limited psychology across the whole of the UK, but I think also across Europe and wider across most of the world at this moment in time. And so if we can create something that helps empower parents without the need for that human intervention, then hopefully that will improve family support and family coping with these conditions, and that in itself will reduce pressure on local services. So my work currently is very much developed with children, young people, parents and healthcare professionals, and we have full ethical approval, and it is NIHR funded. And so what I want to talk about is the work that specifically come from that, looking at juvenile myositis. So we've interviewed 32 parents of those with juvenile myositis, and we have 20 parents who've been involved in focus groups, and we've interviewed 16 children and young people with JM between the ages of 8 and 29 years of age. And that's the work I'm going to be sharing with you today. We asked all of the parents when they came to a focus group about what particular things we should target. What did they think they wanted further help and support with? And as you can see here in this graph, the biggest thing that parents are asking for help with is long-term implications of disease. Families want to know more about how that disease might impact upon them as a family going through over the next 1, 2, 5, 10, 15 years. Following on from that, it's about connecting with other people. It's about other people's stories and case studies. And as you can see here, 22 of our parents that we spoke to wanted to talk to other families in similar situations. We then had coping mechanisms and strategies about how do families cope day to day with the things that their children and young people go through, followed by mental health support for children and young people and for parents. And you can see there the other factors that we had scored on our graphs. So what I'm going to share to you today is about what families have said to us, particularly about the JM journey, its impact on the family, and how we as healthcare professionals can make a difference and make an impact upon that for them. So we ask an awful lot of our families. I really do believe we ask an awful lot of them. So juvenile myositis comes out of the blue. It affects children and young people who are fit, well and healthy generally. And this disease, this diagnosis comes along and it changes the whole family diagnosis, the whole family dynamics. And one thing in particular is the parents particularly struggle with is what they've said to me is being a pharmacist. So it's not necessarily forcing and sourcing or managing treatment, but it's about administering. So families have talked about how they feel that their role has changed as a parent to then administer some medications to children and young people which cause pain and suffering and distress to their child or young person. We also ask parents to be a psychologist to support and counsel their child or young person, to be a nurse, so to assess the daily care that they're giving, to be a physiotherapist to help their child or young person complete their daily home exercises or the physiotherapy that we are recommending to them. To be a teacher about their disease education and their adherence, to be an advocate, to be a dietitian, to be a secretary, to be a taxi driver. All of these roles, these parents didn't ask to take on board. but we have put it on top of them. Their chronic disease that their child is suffering has put on top of them. And how do parents and families cope with that as they kind of move forward? And I think it's really important to acknowledge some of these. So one of the big things is diagnosis, and I'm going to share with you a quote now from one of the families that talked about their journey that they'd gone through in their diagnosis. So we weren't believed. We went back and forth and back and forth. Every time I said something is not right with her, she's sleeping after school, she doesn't want to go out with her friends, she has pain. But she's just lazy, they replied. So by the time we see these children, their young people and their parents in our clinics and in front of us with a diagnosis, that they have had this diagnosis journey. They've often had visit after visit after visit. Families have argued and fought, so they've tried to get their kind of parental instinct. My child is not acting how my child normally behaves. And that journey that they've kind of gone through of that waiting game, trying to find an answer, trying to find out what is going on. We know about misdiagnosis in the sense of the common stuff. So the eczema, the psoriasis, the scarlet fever that families get told. But also families have told to me and in my study about really awful stuff, kind of muscular dystrophy that children have been misdiagnosed with when they actually have juvenile myositis. And the impact that that's had on the family about having then been given a diagnosis, gone away, researched it, acknowledging, accepting it, and then being told that that misdiagnosis was wrong. Finally getting a name, and that has good and bad points in how you deal with this as a family and how you manage that going forward. But actually being heard, got a name, go away, you can Google it, you can look at it, you can tell family and friends what is wrong with you. And how that message is delivered is really, really important. Families have told us about how they've been sat in a room, a physician's come in and said, this is the condition that you've got. It is quite rare. There isn't a huge amount of treatments. You know, we can work together and we can work this out, leaving the room, and then parents looking at each other, looking at their 6-year-old on the bed who turns around and goes, am I going to die? So how that message is delivered is really, really important to our children and our young people and our families. Parents talk about needing that time to digest that information. This is really, really important. We are giving families a condition that they have never, ever heard of before. And actually, how do they then construct that? How do they think about it in their new family dynamics? And families have talked a lot about post-traumatic stress disorder. So by the time actually we see them in clinic, they've often had a journey which is really powerful, which is really important, and has made the family what they are when we see them before us sat in front of clinic at that time point. Thinking about the early days is really important. So this family said, we went from a normal family to one who was trying to manage hospital admissions, appointments, taking medicines, blood tests, biopsies, scans, pain, school, employment, our other children. And also our own grief, loss, for the loss of the life that we thought we would have. And I think that's really important, how families actually then go away and work out what this condition is and how it's going to impact them as a family. A lot of families have told us that they were told not to Google information, but they did go away and Google information because they were looking for stuff. They were craving information. They really need to know what it is that they're facing going forward. And there's a kind of a real finite balance, isn't there, between we give a lot of information in the very beginning, in the early days. We say, this is the condition you've got. This is a whole load of information. But then as families go through that kind of journey, they feel that there's a lack of information that they can understand. We had a lot of parents who talked to us about how they started to upskill themselves on medical journals. They started to read PubMed stuff, trying to unpick and understand what all those different biomarkers and blood tests meant, because they wanted to be on a par with their medical professionals. And so understanding their family perspective and how they're coming at this information is really important. How families explain it to their child who has the condition, that's really hard for families. It's really hard for us as health professionals to explain it to a 6-year-old or a 10-year-old. But actually, as a parent, to explain it in a way your child understands it can be quite hard. Translating for others, so that might be your next door neighbour, that might be your grandparents, it might be the school that your child is going to. As a parent, understanding that information, but then explaining it and understanding it to others can be really hard. Feeling isolated and alone. A lot of parents talked about feeling that they were very alone on this journey, finding their way in the dark, that they didn't know who to go to for information and advice, about how they really wanted to know that they weren't alone in this kind of journey that they were facing ahead of them. Managing the condition is really important. So this can go on for many, many months and many years a lot of the time. And this parent said, I want doctors and nurses to be honest with me. If they'd said he probably feels rubbish all of the time, I would have been less inclined to push the carrots on his plate. But when someone's telling you quite consistently there's nothing wrong with him, he's completely fine, your approach is slightly different. If they'd said actually a large chunk of kids on methotrexate just feel horrendous, absolutely horrendous, I might have done things differently. It's not really until he came off it that you think, no, it definitely was more than just him being a picky 3-year-old or 4-year-old or 5-year-old. And now he's off it. He's back stealing food off to my plate. So families talked about many things in this managing the condition, and these are kind of the top highlights really, but battling with education. And we had some really great examples of how to deal with education and schooling out there. So a lot of the families talked about how they had empowered their child or young person to go in and do a presentation about their juvenile myositis. And actually, we didn't have a single parent who talked about that kind of experience that had gone wrongly. Virtually every child or young person or parent who had stood up in a school environment and done a presentation on juvenile myositis, it had made a positive difference to moving forward with managing their condition. Parents talked about the invisibility of juvenile myositis, and we know that as healthcare professionals, how over time these conditions can become invisible, and how there's therefore a lack of understanding between everybody out there in the social community, but also kind of even as parents, but especially as school teachers. How do you, if you can't see a health condition and you're really busy and you're dealing with a class of 30 pupils, how do you manage to remember some of these things? Parents talked about the importance of persuading their child to do things they didn't want to do, but also encouraging them to be honest. So to take medications that they don't want to do on a daily basis, especially when they feel well, but also then to report honestly about how they're feeling, because often a lot of children and young people are worried about the implications. If they are honest, then some of the side effects and some of the things they might encounter in the future if we change medications might make them feel worse. Parents talked about causing pain to their child or young person, holding them down as they're giving injections, different parent roles in doing that, pulling children out from under beds, chasing children around the house on a weekly basis, and how their role really has changed from being someone who is comforting and safe and the person who really looks after their child to actually the person who is causing harm and is making their child do things they don't want to do. They talked about feeling what is normal for their child or young person. They don't know the side effects, the headaches, the tummy aches, all those kind of things. Is it their child not wanting to go to school on that day? Is it the disease that's causing those symptoms, or is it actually the side effects of the medications? And families talked about this kind of quandary about they didn't necessarily know how to address some of these things. Being the advocate for their child or young person. A lot of parents talked about how they'd gone on their healthcare journey and they didn't actually realise till 5-10 years later that they could question therapy. They could turn around and say, this methotrexate is really causing havoc in our home lives. What else is there out there? What can we change to? So really wanting to be the advocate, support, protect their young child, but knowing where the boundaries were around that. Being the secretary, communicating between different hospitals, carrying different medication, different letters. How do they encourage the next blood test? How do they know what they need to do? And families felt very much that it was their role to make sure things happened. Their child wasn't stabbed twice to have 2 different blood tests because we hadn't communicated clearly between different centres. How to support their child with their mental health. We had a lot of families who talked really clearly and honestly. We had a 6-year-old who tried to end her life on Christmas Day, for instance. So how do families recognise and support their child through their own mental health? How do they realise that they're at a crisis point before they're actually at that crisis point? And then when they are at that crisis point, where do they go for help? Where do they go quickly to get that help that their child needs, and how can they ask for it? There was a lot of conversation about wanting empathy and honesty. So parents talked to us about how they had had conversations with physicians who told them that their child wasn't sick enough. They should be really grateful that their child actually wasn't as poorly as other children that were seen in their centre. They were told they weren't given time in clinics to share their own experiences and how they felt, and how information was delivered to them and how they were believed as healthcare professionals. And also talking in front of their children, they talked very clearly about how a lot of the time they felt that people were oversharing things in front of their child or young person that they didn't want them to. So finally, kind of moving on to living with the condition. So my husband doesn't really understand any of this. He doesn't want to be involved in making decisions about any of it. He doesn't want to go to the appointments. I mean, he will, but he says he's got nothing to offer. Like, I don't know what's going on either. So for me, one of the hardest things is communicating with my husband about this, or knowing how to communicate with him, because we're in different places with it. So living with a condition, some of the things that came up here was that kind of dance with your partner. So actually, when it's working really nicely and you're both sharing the kind of load and going to different hospital appointments and managing the medications at home really well, it can work really well. But equally, it can break down really, really quickly, and partners can feel very alone. And whether that's whoever it is in the family who's taking that kind of primary caregiver load, if there isn't that communication and that support, you can feel very, very alone. We had a lot of parents who talked about blaming the family, about causing pain, causing harm. Why do you need to do this to the child? Why can't you just let them get away with it, kind of? And as parents trying to advocate for medications and treatments that need to be done. Further education and transition, talking about university, supporting children as they go through into young people as they go through into adulthood, and how do parents do that, and how do they kind of cross that bridge? And also, what should parents know? They talked a lot about, I don't know what I should know, and it's really hard for me, because actually it's maybe 5-10 years later that actually someone says to me that I should have looked out for that, and nobody told me that in the very beginning. Do we re-educate? Do we go back and assess what people know? How to help other children. So obviously siblings are really key. There's very little in the literature about how we support siblings, and how as a parent you manage that. We had a lot of parents who talked to us about siblings wanting to be involved. They try really hard to be involved, but actually that child or young person who has the rheumatology condition doesn't want often their sibling to be involved. It's their condition, kind of butt out, leave me alone, and how that kind of dynamics between the two of them works. Putting others first, parents feel very much that they need to look after other people around them, but also that need and desire to meet others is really, really key, and that came out really strongly. And the last thing, I suppose, is recognising their own needs and seeking help. And this is really kind of a very late on thing. Parents talked about actually it got to kind of dire points before actually they started to ask for help, because they were too busy putting everybody else first and looking after others around them. So families said to us, we want to be told there are others out there like us. We want to be given appropriate personalised information. We want to have our options discussed with us, our treatment options in particular. We want health professionals to be honest with us about what will work, what might not work. Don't set us up for false hope, telling us that we're going to be better in 3 years' time, and we won't be. We want the opportunity to talk in private to healthcare professionals, to talk about how we think and feel without upsetting our young person in the room. But we also want staff to be really aware in front of my child and what they are saying in front of my child, who's all ears and actually is the kind of centre of attention in all of this. We want the opportunity to meet others. We want support when we're struggling. We want to be asked if we are okay, and we want reassurance that it will be okay. So I'm just going to end really with a reflection from a father that we spoke to in one of our fathers focus groups. And this is about how he feels. And he said, I feel like every time you go into a particular appointment, you have to be Rain Man. Remember every single appointment you've ever had, every single medication they've ever been on, because particularly for me, who, very honest, is nowhere near as involved as my wife, it becomes a very anxious experience that I'm going to get something wrong. It feels like a test. I'm always worried I'm going to miss something out that is really important, and it means that they'll give him something that they shouldn't, or something like that. So in conclusion, understanding, managing and thriving with JDM really is not easy. Helping children and young people and their parents, importantly their parents, to navigate their journey and reach their full potential really is, it should be, a shared goal. I think you do it so much better over here than we do in Europe, for instance. But taking time to understand where the child and family are at psychologically is key to successful adherence and therapy benefit. And my take-home message for you from my talk today is that you can have the best medicine in the world, but you know what? If your patient won't take it, then it's really not going to work. So just to say thank you to everybody who's really supported this work, particularly the children, young people and their parents, the charities, healthcare professionals, all of the charities that you can see here on board. Also these special people that you can see in the 4 photos, all really, really supportive. And yeah, just really open for questions. So thank you very much.
Thank you so much, Polly, for staying up so late to give I think give us all a toolkit that we can use going forwards. Now, Mark Jansen has asked one question in the chat box. How often did you see post-traumatic stress syndrome in children or parents? Because that's something that they don't actively check for in the Netherlands.
Mark, absolutely great question. It's, you know what, we don't assess for it either in the UK, so I can't say we do. We definitely don't. Parents talked about it, and what was really interesting is we had a lot of the other parents, so not the primary carer, talked about it of their primary carer, if that makes sense. So we had a lot of fathers who talked about my wife or my partner has post-traumatic stress disorder from the journey and the experience that we've gone through. So we don't actively check for it either. Maybe it's something we do need to check for. How do you define it? I don't know. But that journey in our families, I think, is really important to recognise. And I don't think we always recognise it because we almost start from afresh from when the patient's in front of you and moving forward, because that's what you can make a difference in. But actually, I think as healthcare professionals, recognising what's gone on before is really important.
I think just as a nice follow-on to that, Dr. Tarvin just asked that in her personal experience, in JDM diagnosis, she sees an association with fracturing of the family, divorce, separation, etc. Has that been documented in your data?
Yeah, no, it really has. We've had some really frank conversations with quite a few parents who've talked very, very openly about how they wish they could do things differently now, but at the time they were so caught up in their child's condition that they couldn't see the bigger picture. And so actually they were living day to day with so busy worrying about their child and the impact on their child and the medications and the therapies that actually they weren't aware of all the wider things around them. And actually now looking back, especially when quite a few families have divorced and separated, families are like, I wish I'd had more support. I wish someone had said to me, just think about the people around you. And I think that's so powerful. So thank you, Stacey. Yeah, really, really important. I don't know how we support our families to do that in a better way.
And just the last one, just to finish it off so we can stay on time, one from Dr. Feldman up in Canada. What type of professionals do we need to add to our teams in order to properly address families' needs? So have you got a clone, I think he's asking.
Great question, Brian. No, I think just more of all of us. I don't think it's a certain type of professional. I think some of it is more time, more awareness, more kind of all of that, really. The awareness of you do it so much better than we do in the UK and in Europe. You know, you do ask children, young people and families, you do ask parents. I think it's asking those questions is really key, and it doesn't necessarily matter who asks those questions. It can be absolutely anyone on the team, occupational therapist or physiotherapist or nurse or physician or dietitian or pharmacist, it doesn't matter. But often families just want to be asked, you know, and given time to be able to offload and to talk about some of their experiences and not to feel so alone on their journey is really key.
We are going to have to wrap it up there, but again, thank you very much, Polly, for staying up late. And there's a lot of very nice comments in the chat box about your presentation.